Welcome to Muddy River News this week, furnished by Harvey's. I'm Bob Goff. My guest today is Maureen Kahn, the CEO of Blessing Health System. Welcome.
Thank you. Good to be here. It's been a few months since I've seen you.
Yeah, we moved to a different room.
I
get
know.
Some more lights. So yeah, same old chairs though. So, but Harvey's we've gotten some nice ones. We might have to get some more nice ones. So, well, thanks for stopping by. One of the things that you wanted to discuss today, a little bit of breaking news on the show. June 1st was the deadline for you to appeal the board permit for Quincy Medical Group's small room hospital as well as birth center over at the Quincy Town Center, and you are appealing part of that, you're saying?
Correct. We are filing an appeal for the small format hospital. We are not appealing the birth center that they have received a permit for. And the Board of Trustees has decided that it's important for them to appeal the process to make sure that everything that was followed should have been followed. And so that's what they're looking at, and we'll go through that appeal process.
And is there a timeline on this where you will get a decision?
We haven't gotten that yet. The state will give us a timeline. It should be relatively quickly because it's not a process that involves calling people forward to testify or new witnesses. They look at everything that was garnered during the process. So everything that's on the record is already there,
Sure.
So it's not new information. They just go through and make sure that the process was followed the way it should be. And then a judge will rule his opinion.
And this is an appeal, but it is not a stay, correct?
That is correct. It is not a stay on the process. So everything still moves forward.
Okay. Well, we'll see how that breaks down. I'm sure we'll hear more from that in the future. But again, you had stated that this is just an appeal of the process, but still again kind of give the
reason
blessing,
behind it,
right? Yeah, the blessing reason behind the appeal overall, well, philosophically, I guess.
I think the reason behind it, as the board went through their processes, was thinking about this will eliminate the sole community hospital status for Blessing. And that is important to the board as it helps support a lot of the programs that we provide at the facility. And they felt they didn't want to just not step forward and do something on that behalf. So that was one of the big reasons why they took that action. Also, this type of implementation of a new small format hospital has implications throughout the state. Because currently, right now, the rules in the state of Illinois to build a new hospital is you have to have at minimum 100 beds. And so it's not in keeping with the state's own rules.
Okay.
And so they felt we needed to make sure we were following the rules of the state.
Okay.
So I think it was a precedent-setting issue, and it was also for the sole community hospital. And that benefit helps us do things like the trauma center and different programs that we offer, whether it's that or behavioral health or the education of healthcare workers that support the health system.
All right. Well, again, thanks for letting us sharing that information with us, and again, we'll follow up as the state moves forward. Then.
Mm-hmm.
So, I want to bring up another dirty subject, and that's COVID. How are we doing? Are we done? Can we not do this anymore, please?
I wish I could say we don't have to do this anymore, but it is back. I think today in Cranes they said Chicago is back up in the high area for incidence of cases. But the one thing I would say about the strain we're dealing with right now, it is much more of, I want to say, a mild type of a strain. It reminds you of a flu-like type illness. We're not seeing as many patients admitted into the hospital like we did with Delta and Omicron, but we are seeing that it is very contagious and easily contagious. But you're going to see people with symptoms of flu-like, upper respiratory, but maybe after about 5 days you're feeling much better.
Well, especially if you've gotten the vaccine and the boosters and you're doing all the stuff you're supposed to do. So
I think you're going to see this is going to be almost like you get a flu shot, you get one of these boosters, and once a year we're probably going to do something like that. And it's going to be a new way of life. It's like another type of thing we live with.
Well, and then I guess one of the other things in dealing with that is when we still go to local healthcare facilities, that's still also one of the few places where we're asked to wear a mask. And again, it's fine with that. And I mean, I think if there's going to wear one anyway, it would be there. So as far as that goes, that's just do you think? And again, is this a process where we may be wearing the public may have to just wear masks in hospitals as kind of a standard practice?
You know, I think you're going to see it in the patient care areas, yes. If you're around people who are going to have upper respiratory illness, I think that's going to be a way of life. I think our staff would love to be able to take them off, but no, I think it's becoming a way of life. We in our offices are finding that we can take them off, and we're feeling much more comfortable with it, but when you're around and you can't keep distance and there's larger crowds, no, they're going to be mask wearing. And I think we'll find different times of the year we may feel more comfortable in putting a mask back on again when we see the flu season or something like that pick back up. But I know you're going to see some people still feel more comfortable on a plane putting a mask back on. I don't know what it is when you get on a plane, everybody starts to cough. I don't know if it's the signal. All right, everybody, let's clear our lungs.
That's true.
Let's let it all out and share it with everybody.
At least we can't smoke on planes anymore. That
You're
went
right.
away a long time ago.
That changed, and I think that has made it for the better. But you know, it's just going to be a different way of life. And our staff went through a lot. I think the community went through a lot. Yeah. And somehow we didn't learn how to balance that lives and livelihood. Yeah. And so it caused a lot of stress in people.
So move on to some of the other subjects. The surgery center, still a relatively new facility for you guys. How's it working out?
It is working out fantastic. It's a beautiful center. If you ever need to come by and have something done, come on in.
My wife had something done. It was great. In, out, no problem.
We're very pleased with the construction. We just went through we just were re-inspected, and it was our inspection we've been waiting for I don't know how many months now, but it's done, and it was a great inspection, but we're pleased.
And you also had mentioned the trauma center. We're really seeing that when you talk about just trying to provide that service for people. I mean, again, there are still cases where you're going to have to utilize air evac to either come in and then go out. But the trauma center, it's been upgraded enough to where there are those cases where you're flying out, fewer and farther between. You're able to kind of handle more things now.
We fly very few people out.
Okay.
We get more people flown into us than we fly out of our organization. So we are very fortunate to have the talented physicians that we have in this community who can do and handle almost any type of trauma.
And something else that I think is important to people as we're just wrapping up sports season and kids are having their aches and pains. Your orthopedic facility seems to be pretty busy as well. I know you guys are part of Advance and all that stuff, but that's all moved out to 48th, right?
All out at 48th and Main at our center out there, and I'm telling you, we've got some great orthopedic doctors out there working with our young people and our old people, and I'm putting myself in that old people category. But some great doctors, some great trauma docs, some great sports docs, and they are really putting the athletes back out onto the field in great shape as soon as they possibly can so they can keep playing their sports. And that's what they want to do, and that's what their parents want to do, because they want to see them either get scholarships or whatever. They want them to continue to play.
And again, it's just, it also that goes into that, though, is so much of the rehab part of that. After those kids are all done, it's, used to be if you had a knee injury, okay, you were toast for a year, 18 months or whatever. But now it seems like they're able to just bounce back so much faster. And a lot of that has to do just with the technology and the progress that's been made in that field.
Absolutely. These kids are getting rehab, and, we have a partnership with Advanced Physical Therapy, and, they work these kids and get them exercising and back out on the field. And it's all about the strength training that they do, but they do it every day as they are training for the sport.
Right.
So they've got some good muscles supporting whatever they do.
Yeah, being in shape like that always helps you
It does.
prevent the injuries
You're
in the
not
first
kidding.
place. That's for sure. So, last question again. More breaking news we need is still. I'm going to ask about 14th and Broadway. It's a nice, beautiful patch of grass, but are you about ready to tell us what's going to be there besides just a place to walk your dog?
We don't have anything yet to make an announcement on. You know, as with all of us, you know, I'm not going to say post-COVID because it's not done yet.
Right.
But all of us have learned, you know, we sent a lot of employees home to work. And so now we've been spending a lot of time right-sizing all of our buildings because people aren't coming into the buildings to work. So what do we need to do with this space? And
That's true.
it's been, we've gotten out of some rental space in our buildings. I think the only new building we have under construction right now is our hospitality house, which hopefully in late fall will be coming up. And that's really for the whole community.
Right.
You know, if you're coming to see somebody or you're getting treatment, you can stay there at the house. But we think we're not going to have to build another building for quite some time because of all the people we have working from home, and they seem to like it. And then our doctor's offices, telemedicine has really taken hold. And so now we're right-sizing all of our offices because there are some patients that we're going to continue to see via telehealth. And as you know, we started hospital at home this past year. And that's going to be another thing where patients aren't going to be in the beds. That's technology. So it's been, you know, everything is changing. And that's what healthcare is all about.
Sure.
We're constantly changing. And I think if our grandparents or great-grandparents were around, they would say hospital at home is not new.
Good point.
And that's the kind of care. You didn't go to the hospital.
Right. That's true.
Unless something was really, really seriously wrong with you, or you were having a baby, or they wanted to operate on you.
Yeah.
You stayed at home.
Well, of course, there will always be need for a hospital, and Blessing's been around for a long, long time and will continue to serve the community. And again, I want to reinforce it's always one of the area's largest employers as well. So I want to thank you for your time, Maureen, as always.
It's always a pleasure to come and see you, and hopefully we'll have a great summer, you know, with some nice weather and not bad storms.
Not bad storms, and again, let's hope the COVID thing's just a blip this time.
Let's hope it is as well, and we'll keep you posted on what's happening here.
All right, thanks a lot.
Thank you. Good to be here.
Thanks. That's all the time we have for now. I'm Bob Goff with Muddy River News This Week. Have a great week.